I'm Irin Carmon. It's a pleasure to be here at the Strand with you guys. Thank you so much for coming. It's an honor to share the stage with these women who are working in so many different disciplines to try to protect women's bodies, the bodies of marginalized people, the rights, freedom, and access to justice of people who have been denied it and are continuing to be denied it. So I want to start out, I know you heard their titles already, but I want to start out letting these powerful women speak for themselves to tell you a little bit about what their work is, just like 2 or 3 sentences. What does that fancy title mean? Jessica.
Hi, everyone. So good to see a full crowd. And there's my partner and my child here. It's a family affair. My name is Jessica Gonzalez-Rojas. I'm the Executive Director of the National Latina Institute for Reproductive Health. And we are an organization that builds Latina power to advance health, dignity, and justice, the human right to health, dignity, and justice for Latinas, their families, and their communities. And we do this just a couple ways. We do this by elevating the voices and the leadership of Latinas, mobilizing our families and communities, shifting the cultural narrative, and catalyzing policy change. So we work nationally, and we're also based and have bases in New York, Virginia, Florida, and Texas.
Thank you. Anne?
Hi, I'm Ann Davis. I'm the Consulting Medical Director for Physicians for Reproductive Health, which is an advocacy organization. So we work to promote comprehensive reproductive health care with a focus on abortion and contraception for everyone. Also, I'm an OBGYN. I'm an abortion provider, full spectrum abortion provider. I'm also a director of a family planning fellowship program, so I teach young doctors and fellows how to be abortion providers. And I do research. My research is in, some of it's abortion research, most of it is in contraception. And if anybody needs any medical care, you need a gynecologist, we pretty much take all insurance, and we're at Columbus Circle.
Now would be a great time to go into
I don't know if
labor.
anybody needs their IUD right away. Yeah. Although after last week, it's getting a little chill on that now. People aren't panicking quite so much about getting an IUD, but we're there for you.
Do you think they have room in the back? Does anyone have a speculum with them?
Right after.
That's so 70s.
Hi, everyone. Alencia Johnson, Director of Constituency Communications at Planned Parenthood Federation of America. I know that's what is that title? So I have the opportunity of developing communication campaigns that talk about reproductive rights and healthcare and access to that healthcare at Planned Parenthood to communities that are impacted the most, from people of color, young people, LGBTQ communities, faith communities. Just a little plug, we're having our first clergy teach-in tomorrow in DC, because don't let anybody make you believe that people of faith don't support Planned Parenthood or reproductive freedom. So it's a cool job. It takes me around the country to our affiliates, which we have almost 500 health centers, and just really distilling down on what these attacks on our freedoms looks like for the people that would be impacted the most.
I'm Sybil Shainwald. I'm a lawyer, and I've been representing women since I graduated from law school.
Sybil, do you mind speaking into the microphone this way? Yes.
Okay, sorry. Is that better?
Yes.
I'm still a lawyer. Anyway, all I've done is represent women through my whole career, and I've represented women's health issues particularly. So I had the first DES case, the first Talcott Shield case, there were 1,000 of those. And the first Polidel case, which was a drug given to dry up milk, which nobody needs, as the doctor will tell you. And so I've represented women, and as I say, against pharmaceutical companies like wonderful Eli Lilly, Abbott, Merck, Squibb, I forgot Squibb. So, all the bad boys, right? And I was born a feminist, is what I say, and will be a feminist. So I've always been interested in the rights of abortion rights, always. I went to the march in 71 or 72, whenever it was, and then of course I was very happy to hear about Roe v. Wade, and I've written a history of abortion, which has to be updated, but I left it in the back. I left a few other things. A map of which states do what. So just, pick up the materials, and if you need further information, just call.
Thank you so much. All right, so Jessica and I were just remembering that we were on a panel together 48 hours after the election, and when we agreed to do the panel, which was not actually related to contemporary politics, I don't think we would have imagined what ended up happening. Like, I was like, oh yeah, I should have been caught up by sleep and writing my first woman president piece, and and you all know what happened. And so here we are in this room, and it's so easy to feel joyful and connected when there's so much incredible work happening. But we can't ignore that nothing was easy before, but we are in an unprecedented moment of attacks on the very causes that you folks every day, and maybe they aren't even a cause, maybe it's just taking care of your patients, but the world has politicized it. So I want to ask you, just last week, Alencia, I'm going to start with you. Just last week, we saw Planned Parenthood defunding, quote unquote, being part of this dream bill that they cooked up. We expect to see Planned Parenthood back in the crosshairs when it comes to budget time. So from that day, that Tuesday in November, that I'm sure everybody here has a memory of exactly where they were when they realized that Donald Trump was going to be the president of the United States of America. So what are you guys dealing with? What do you expect? What's it been like up until now?
Oh, wow, that's a lot. How long do I have? I actually remember election night. We were all at the Javits Center just excited, and then around 9:30, I'm from Virginia. Virginia was too close to call, and it was a very scary, real feeling. And then my colleagues and I were up until 4 o'clock in the morning and got on a 7 a.m. train to DC and started planning what was our resistance going to look like. And I think most everybody, not just people in our world, in reproductive healthcare, reproductive rights world, just in general, we were in this state of shock. What do we do? What do we do now? And I'm inspired by the Women's March when they came together with Tamika, Linda, and Carmen. Particularly, they brought together this united front of women pushing back and pushing this resistance. And that kind of set the pace, I think, for a lot of folks and really honed in on grassroots efforts. And so that's what Planned Parenthood honed in on. We have all the polling that shows that 80% of Americans don't believe in eliminating access to health care at Planned Parenthood, even over 50% of voters who voted for Donald Trump. And so we had to capitalize off of that. And so what does that look like? It doesn't look like doing all the nice, dinners and things like that in Washington, D.C. That meant actually going into the states, going into the places where people were at risk for losing their health care. Over 50% of our patients, which are 2.5 million patients we see every year, over 50% of those patients receive their health care thanks to Medicaid. And they were at risk of losing that. And so even just this past week, our teams pulled together over 1,000 events in different states, grassroots efforts with partners to push back on this narrative, to also show elected leaders, hey, we may not have voted for you, but you represent us, and this is what it means to take away our health care that we want. And it could be dangerous for you if you actually vote the wrong way. As we saw on Friday, they actually didn't even vote. They just got rid of the bill. I mean, you had 7 years. Nobody had a blueprint. Not one of those almost 60 times you voted on the ACA repeal. No one said, let's actually write something down that actually could work. We know it couldn't work, but, and to your point though, with the upcoming budget, there's about 12 days for Congress to figure this out before a potential shutdown. Planned Parenthood will be on the chopping block. And they say defunding Planned Parenthood because they don't support access to abortion care, which is some of the work that we are proud to do. But it's a bigger conversation about they don't believe in women being able to make decisions over their bodies. And when you attack access to healthcare at Planned Parenthood, it's not just our health centers, it is other abortion care providers, it is other safety net providers who are literally the only healthcare providers that many people have. And it's also discouraging the picture the White House tweeted out of all old white men. Yes. Talking about birth control, maternity leave, I mean, everything. It is frustrating that that is what is happening in 2017, but our efforts this time around, and as always, but really this time around, is a grassroots strategy and linking arms with everyone who has something to lose, because there's so many fundamental rights that are being chipped away at. They're really starting with low-income folks and people who need access to health care, who are on safety net programs, and they're going at Planned Parenthood.
Right, and some people in this room may not know that, in fact, none of the funding that goes to Planned Parenthood goes to abortion. Much to the dismay of activists pointing out that hurts low-income people. But nonetheless, their stated opposition to Planned Parenthood funding is supposed to be that they disapprove of abortion, but the money doesn't go to it.
Exactly, because of the Hyde Amendment, which we're over, and I would love for Jessica to talk about the impact of the Hyde Amendment, but it is punishing low-income and marginalized women from being able to access abortion care. And so, of course, we were so excited when Hillary Clinton, as well as the Democratic Party, put repealing the Hyde Amendment in their platform. Like, this was going to be a huge win for our movement, right? And just to see that it was chipped away, and they're still using something that's been law of the land for over 40 years, they're still using that against Planned Parenthood.
Sybil, can I ask you, since we're thinking still about that, for many of us, traumatic experience of the election, you've been at this for a while. How would you put it into context? We have this man who was caught on tape bragging about assaulting women. Now he's elected president. Are we in the moment of backlash to women's health and reproductive freedom and women's rights more broadly? How should we be reading this moment in the context of history?
In the context of history, let me say that a woman could not argue before the Supreme Court. She was sent home. Myra Bradwell was sent home to take care of her children and her husband, but the fact is she was single. But she could go out and get an abortion. Abortion was always legal in this country until Connecticut passed the first post-quickening, banned the first quickening abortion. And then in the 19th century, there was an erosion of the quickening doctrine was replaced with belief that the fetus is a living human being, and that from the moment of conception. So states introduced statutes that cut down on women's rights. In 1829, New York introduced a statute that made abortion illegal at all stages of pregnancy. Until 1967, 49 states and the District of Columbia made abortion a felony offense. Now that's really unbelievable, isn't it? In 1973, of course, post-Roe, that was followed by 25 years of legal abortion. But the whole history of abortion rights in this country is fraught with, battles. But for a long time, abortion was legal. Then there was a period of illegal abortion. Now we have, we had Governor Pence in Indiana, who was probably the harshest one of all the governors, who was against all abortion rights. President Ford supported passages of constitutional amendment to allow states to regulate abortion policy. President Reagan approved an anti-abortion constitutional amendment and a right to life bill. I mean, we really have to look back at how, we started out as abortion was free, available. That was in colonial times. And it wasn't until much later that abortion had criminal statutes attached to it and so on. So I'll tell you what Texas Governor Rick Perry said. An ideal world is one without abortion. I am so proud that Texas always takes the lead in trying to turn back what was started in Roe v. Wade. And then I want to tell you about some of the recent restrictions in the states. 15 states have near total criminal bans on abortion that are clearly unconstitutional. Louisiana and Utah enacted the bans almost 3 decades after Roe. Mississippi, North Dakota, and South Dakota have trigger laws that would immediately result in a criminal ban on abortion should Roe be overturned. In 2011, Ohio became the first state to ban abortion as soon as a fetal heartbeat could be heard. Despite Roe, the majority of states have unconstitutional bans that would outlaw abortion as early as 12 weeks of pregnancy with no exception to protect the woman's health. But I do want to tell you something that's going on now that is more heartening than that. Several states, beginning with Florida, and I'd like to show this clip first of the women who argued the case in Florida. The battle is being fought in the states. So I wanted you to see one of the
when a woman learns
advocates
that she is pregnant, she understands
for
that she has
abortion
two
rights.
choices: continue the pregnancy or end the pregnancy. The unrebutted record evidence is that women think long and hard about this decision and take it very seriously. And under existing Florida law, if a woman, after receiving appropriate counseling from her doctor, is not yet ready to make this important decision, she can absolutely take another 24 hours or more to think about it. So what that means is that this law actually only impacts the women who are ready, the women who do not want or need to delay their procedure any longer. Now, the state argues that this mandatory delay law is not designed to try to encourage or discourage women from choosing abortion. But when the only women who are impacted are the women who are ready to proceed, clearly the state is sending a message that it wants women to reconsider their decisions, that it disapproves of their decision, that it doesn't think women are capable of making this decision without a government-mandated delay. And that is not a legitimate interest under this court's binding precedent, particularly where this law applies from the very start of pregnancy. Now, I want to acknowledge the state's argument about the other delay laws that exist in Florida law which have not been challenged. To the extent that the state is preventing a person from exercising a fundamental right, that law would likely be subject to strict scrutiny as well in other contexts. Then, of course, you have to balance the state interests. The state can, of course, try to present evidence that a mandatory delay law for marriage or for divorce, for instance, serves a compelling interest through the least restrictive means. That is a separate question. Again, that doesn't change the fact that this is a direct intrusion into the woman's private decision and that it should be subject to strict scrutiny. And finally, I want to make a point about the adequacy of the TI order.
Just so we understand, because the public listen, TI means temporary injunction.
Yes,
Okay?
thank you, Your Honor. There are really two questions before this court when it comes to the sufficiency of the temporary injunction order. First, is it correct that constitutional injury is irreparable injury? And second, does preventing irreparable constitutional injury serve the public interest? If the answer to those two questions is yes, the temporary injunction should be affirmed, and we know the answer to those questions must be yes, both because this court has previously affirmed an injunction based on the presumption that constitutional injury is irreparable harm, that's Smith v. Coalition to Reduce Class Size, and because defendants conceded that if this law is allowed to take effect and then is later found to be unconstitutional, plaintiffs and women in Florida will have no adequate remedy. Of course, the question of adequate remedy is interwoven with the question of irreparable harm. For all of those reasons, the TI order should be affirmed, and this court should clarify that this overt and direct interference with the private decision to have an abortion must be subject to strict scrutiny. Thank you.
Thank you for your arguments. The court will be in recess for 10 minutes.
Well, as a result of what I consider to be a very brilliant argument, the Florida court, on state constitutional grounds and privacy issues, found abortion to be legal in Florida. So that was really a good result and a recent result.
Sybil, thank you so much. I just want to make sure that some of the other panelists can jump in here.
Okay.
Jessica, we were talking about that moment immediately after the election. Can you tell me what you and the Institute have been up to since then? Because you've seen a huge spike in deportations. Today, Jeff Sessions talking about going after quote-unquote sanctuary cities. Tell us more about what the last few months have been like for you and the communities you work with.
Thank you. Yeah, we Alencia started alluding to this, but the framework that we use in our work is not just looking solely at protecting reproductive health and rights, but also looking at all the conditions that women face. I often joke, like, women are not just uteruses, right? We have all sorts of identities and conditions that we face because of different parts of our identities. So reproductive justice cannot be achieved without looking at racial inequities in this country, looking at this horrific immigration system we're operating under, looking at the way low-income communities are treated in this country. So we, as an organization that advances reproductive justice, that's the kind of core framework. And we believe those most impacted are the agents of change. So I can't remember if I shared that night, but the one thing that actually inspires me to keep going, despite the horrific dangers that are ahead and the egregious policies that the president has put forth, or at least tried to put forth, is that the community most impacted, and we work in places like the Rio Grande Valley, South Florida, Northern Virginia, some of the places that are most hostile to women's health and rights. That the case in Florida here was something that we were involved in as well. But our women that organize in the Rio Grande Valley, a very, very low-income community, mostly Spanish-speaking, mostly immigrant women, many who are undocumented, many have different statuses. They shared an email the day after the election when I can barely get out of bed, and I had to take my son to school, and I had to get out of bed, and I had to go to the office. But I got an email from her the next morning, and it was a photo of her and about 24 other women holding clipboards, and they had their fists in the air. And she said, it's in the email, hermanas, sisters, today's a hard day. But remember, despite who's in power, there's not ever one person in power that can take away our dignity, that can take away our agency, that can take away the power that we've built in the community. And I'm sharing this photo to remind you every day of the power that we built in the community. And what those women were doing that morning, it was from the day before, they were going out and knocking on doors and getting low propensity voters to come out and vote, and many for the first time. So that is what keeps me going, despite the president's trying to achieve the promises that he made. And it's just been really, really hard, because despite everything we face in terms of trying to repeal the Affordable Care Act, we're also seeing him make good on some of the threats he's made around, banning Muslims from this country and deporting families. And he talked about bad hombres. He's going after mothers, grandmothers, children, families. Tearing families apart. And to be honest, many in our community, because we work in the community, are so deeply impacted. We're having partners of some of our activists being detained. We're having other family members being detained. And right now we're sort of trying to find the resources to help those families, but we're also speaking out. And I think that's the thing that helps me move forward, because I know that they've found their voice and they've found their power, and they're finding every way, whether it's going to a rally, whether it's giving testimony at a hearing, whether it's writing op-eds or speaking to the media or telling their stories. That's what's kept us going forward, because we know that the solutions lie in the communities most impacted.
It's incredible, because the cost of speaking out right now is so high for some of these folks. I'm sure you know of the woman in Jackson, Mississippi, who spoke out about being a dreamer and was deported.
Yeah, and she was not yet deported. She was actually released. She was detained moments after sharing her story. And generally, press conferences and rallies are deemed sensitive locations, meaning sort of safe spaces. So that was a true violation of that safe space. And we're worried, actually, that while ICE agents are not supposed to go into hospitals and schools and churches, we're hearing that they're roaming outside those spaces. So that's a real threat to our dignity and to our livelihood in a lot of ways. And just one quick example, in Florida, in Miami, the threat that the president has put forward around defunding sanctuary cities, our team went and testified before a body in South Florida. And because he said the word immigrant, they cut his mic, and he kept talking, and they escorted him out of that hearing. because he was speaking up. So there is a threat to speaking up, but I believe what I'm seeing is that they're willing to take that risk because it's so important. And those that have the privilege, that have citizenship, that can speak English, they're making sure they're standing alongside them to back each other up.
I mean, the idea that ICE agents would come to hospitals, it's a reproductive justice issue among many other things, right? I mean, are you seeing, Dr. Davis, how are you seeing the impact of this selection on your patients, on your practice, even on your research? Can you tell us what you've been experiencing through your work?
Every damn thing, every damn day. So it's been a wild ride, mostly down. So, but last week was good. We had a good, nice big egg on face for the Donald and his friends in the clown car. So the day after the election, so I went to a party. It wasn't the Javits Center. It wasn't that big of a party, but some people in my building had a party, and we were all there with our guacamole and chips and beer, ready to celebrate. And like many of you, probably I had this feeling that I was just full of from voting, right? So I'm from Rochester, New York. And anybody here from Rochester? Oh, cool. Where are you from? Oh, Buffalo, close enough. Buffalo's a beer city, Rochester's a wine city, but we're not gonna go there. So it's true. We went, I took my daughter to vote, and the reason I bring up Rochester is because all these people in Rochester were putting their Susan B. Anthony stickers on her grave after they voted, and there was this great picture that went around of people, just this giant line of people waiting in line to put their stickers on her grave. And we went to vote, and I took my daughter with me, who's 13, and she was so proud and excited and happy. And we went to the coffee shop, and everybody was hugging each other. All the people from my building and voting, everybody was so excited. And then we went to this party, at night, and I just started to get that sinking feeling. And I don't know what time the sinking feeling set in for you, but yeah, once I was like, okay, let's see, I'm kind of a scientist person, so if it's randomly going red state, blue state, we're having, because people say, oh, we got that one, oh, don't worry about that one. This one, oh, don't worry about that one. And I was like, this isn't random. This is a pattern. Red state, over and over again voting for Trump. So I just bailed and left because I couldn't take it. I was getting a stomach ache. And then tried to sleep, but couldn't, obviously. Woke up early in the morning and, like everybody, right, had to figure out, like, how to face work and how to go to work and try to face it all and deal with all of it. And just feeling so incredibly deflated. We were going to have a champion in the White House, a reproductive rights champion, a woman who came right out and said that the Hyde Amendment had to go, a woman who unapologetically supports abortion rights. I don't know if anybody saw that thing in the Times about the Democrats need to dump abortion because it's gonna, I just wanted to give that guy the finger in person.
Today's paper.
Yeah, it's like, will you stop? Like, no, we're not gonna dump abortion rights. No. So anyway, yeah, and I was like,
well,
I do tip, but anyway.
I do definitely want to talk about that guy and sort of some of the controversies, but I really want to hear from you
about the hospital?
About your patients.
All right, so then, just to finish this. So I went to work, and I'm sitting at my desk, like randomly moving papers around the desk, because that's all I could do, like going like this and like trying to, and I hear the people, the people who answer the phone to make appointments, our medical secretaries, and one of them says to the other one, did another person just call to get an IUD? And I was just looking for any type of distraction. So I went over there and I was like, what's going on? And they said, we've had 6 phone calls for an IUD. This was the morning after, right? Not like a week later, 2 weeks later, the next day, less than 24 hours. So we have had like a quadrupling of, and I know Planned Parenthood's got the same thing writ large, right, at your affiliates, but so many people coming in to get birth control and get their IUDs, and when you ask them why, and they say pretty much because of the election, and then when you ask them to elaborate, they say, well, I pretty much have the feeling if I have an unintended, if I have an accident and I get pregnant, I'm really worried that I won't be able to get an abortion. So I need to get the most effective thing that's going to last the longest. I'm afraid I'm going to lose my coverage. I'm not going to be able to get this IUD if I don't get it now. A lot of people were thinking about getting it anyway, and they're like just came in to get it because they just felt really threatened.
Right, and just to throw in a little context, that is specifically covered under the Affordable Care Act.
Right.
It looks like everyone in here knows about it.
Yeah.
And was in the crosshairs in Hobby Lobby, specifically these very effective forms of contraception, including
Right,
the
because
IUD.
IUDs cause abortion. So stupid.
That's your medical opinion, right?
Right. Everybody who has an IUD, every month they get a positive pregnancy test, and their period is late for 2 weeks, and then they bleed. It's like, no, it's not causing abortions every month. That's completely stupid. So we have that going on, and then I think what we've got going on with our abortion patients is really kind of a crazy, panicky feeling, which is that people are grateful in a different way for their abortion. Usually people are just, grateful that they're getting good medical care and that people are nice to them, the usual kinds of things for other kind of medical care too. But what I'm seeing now is sort of a special kind of look in the eye from people, especially when we do the later cases, the second trimester cases, like the ones I did on Friday, and the families are saying to me, and women obviously are saying, thank you for helping me in a different way. And I know the subtext. The subtext is, I got in under the wire. Because if this had happened next year, maybe it wouldn't be available to me at all. And here you are, and here this place is, and everyone was nice to me and, gave me kindness. So there's a lot of, I think there's a lot of anxiety just in general about what's going to happen. And then, last week, everyone in the hospital is worried about NIH funding for research. And how about taking the CDC money and giving it to the states? Because you know how epidemics stop at the border between New York and Pennsylvania. I was like, oh, that's a great idea. We should definitely give the CDC money to the states.
And also cutting maternity care.
All HCG not covered. Yeah, we were like, what do you mean maternity isn't covered? None of it? What do you mean? All pregnant women aren't covered for
pro-life.
anything?
Hashtag pro-life.
Yeah. Right. Like, well, okay. Yeah, really something. So kind of totally amazing. And I think, when do they catch on that saying dumb things about basic reproductive health helps you get voted out on the next round? I mean, like with the mammogram thing, Lebba?
Yeah.
Oh,
This is that Pat
paying
Roberts.
for mammograms. I was like, do you want to make people psycho and vote against you? Because why don't you start talking about breast cancer?
Right.
Okay, like let's bring down the whole world of hurt on you next time if you start talking about breast cancer. Like, okay, let's put abortion and birth control over here. Breast cancer, bad idea. Okay,
Right.
all of it bad idea, but particularly breast cancer.
Just
that was just so
constituency-wise.
dumb.
Well, and I think it's really telling to me, though, that when you have these guys explaining why they think these coverage requirements are so ridiculous, that they don't hear themselves when the first thing that they say is like, can you believe I have to cover this? Maternity coverage, mammograms, like they think that will sound ridiculous to everyone they're talking to, which just tells you who they expect their interlocutors to be. So I have some crazy news. We have 5 minutes left on this panel. I know it feels like we just started, but we want to leave time for questions. So here is what I'm going to ask all of you. I know we're just getting started, and I hope that the folks will continue to engage in this conversation. A few of you talked about the resistance that we've seen in the streets, and I think that, on those days that everybody talked about immediately after the election where people were feeling hopeless, I know that I didn't predict that there would be this much organizing, outreach, people really showing up. And so my question to you as veteran people working on these issues is, what should folks do? How can organizations harness the energy that's out there? What are some strategies that people in this room, who I'm pretty sure I see you guys nodding, are really interested in getting involved? So what's your advice? Jessica, I'm starting with you.
Sure. There's a lot that can be done. I mean, showing up for other movements is critical. So if reproductive rights is a thing you care about, show up for racial justice, show up for immigration. There's a science march coming up. Science and reproductive health and rights certainly intersect, especially for people that believe environmental justice, right? So I think that's one thing we really want to lift up. And what's exciting from the Women's March is that intersectionality, that word, became mainstream. And women of color who've been fighting for reproductive justice have been talking about intersectionality for decades. So it's amazing to see it elevate as a framework that a lot of folks have been connected to and finally get. Also, please donate. Organization like any of ours here. There's also abortion funds that I'm sure will need it more than ever, that actually help women in particularly in tough states, but even in places like New York, the abortion funds, their lines are always ringing. Join our website. There's a lot of sort of digital activism you can do, but most importantly, show up. Donate, use your resources, whatever you can, host parties, and call your elected official. Call. It makes a difference. When the AHCA, the Republican version of the non-healthcare bill, when that was being, when there was some energy behind it actually getting to the floor, I noticed on Twitter that elected officials were posting, I got 15,000 calls against this bill and 10 for it. And they started posting it, and I was like, this is brilliant. Like, our calls matter. So, if you're afraid to, go to their elected official or show up at a community meeting, make a quick phone call. It is literally like, I live here, I'm your constituent. Please don't vote for this bill. It'll hurt me and my family, or I care about this issue. Whatever it is, please make those phone calls. They really, really do matter.
Yeah, even if you live in New York, I mean, look at the impact it's had on Chuck Schumer.
Yes. Yeah.
Anne, what can folks do?
It's a marathon, not a sprint. We've been working on this stuff for a long time, especially abortion rights. Even with this outcome, we were in the worst situation with abortion rights that we've been in since Roe. We have the most restrictions we've had in the States, but we can make positive change. There's things you can talk to people about in New York trying to move things along. We can be visionary. We're never going to catch up to California, but we can be second. Anything that you see that you really get behind, really let people know about it. All politics is best local. Everyone tells me if you want to call Paul Ryan's office, it's kind of a waste of your time. Call people in New York, let them know what you think. Right now, the particular one they haven't heard enough about, I heard on a policy call today from the DC people, is Supreme Court nominations. People were very, very, very active last week with the ACA. Everybody's relaxing a little bit now, but we got to get back to them about why, what we feel about the Supreme Court nominee, to hear about
Who's
that.
bad?
Yeah, I don't like him either. He's not going to be our friend. So all of that is great. Yeah, give money, show up. And I think really just... don't fall for it. If someone tries to talk you into it, why you should have to wait 3 days to get an abortion after you talk to the doctor, don't fall for it. Does that make any sense to you? Use your common sense and don't fall for this nonsense. Don't fall for this stuff. Speak up and use your common sense and, what are we supposed to say? Speak truth to power. Do that. Or just speak truth to other people, even if they're not in power. Your friends and your colleagues, and, just stand up for the right thing and keep doing it.
Tough acts to follow. Taking a lot of the stuff that I tell people to do, but really pinning a point on this, like showing up for other movements. I was wondering, before I started working at Planned Parenthood, almost 4 years ago, I worked on the Obama campaign, the re-election campaign, and I was like, what is it gonna take for progressives, I'm speaking, so I'll take my C4 hat on now, Democrats, to actually have a more inclusive platform. Didn't think it would be this, right? Like losing so much, but just the beauty of the Women's March is that read that platform. It is so inclusive. Fortunately, Planned Parenthood had a chance to work on it as well. But what was interesting at the Women's March is that as I was leaving, I was on this high, but I was leaving, I was getting on the metro, and there were a lot of people there who were like, oh, well, we just really wanted to talk about women's rights. And I'm like, racial justice, immigration reform, environmental justice, all of that, those are our rights, right? We are layered, complicated beings that have so many different identities. So to Jessica's point, link arms with other movements and get uncomfortable and then have I don't think any of us we probably don't have a lot of opposition in our friend groups. I mean, I've moved away from the people I grew up with in Virginia. I blocked them on Facebook, but I.
Is that a tip?
That's not a tip because, they come for me because I'm the daughter of a pastor who actually supports me working at Planned Parenthood. Like, he is supportive of the work that I do. And it throws them off, right? Like, it throws them off, and I love it. And I realize how we got here is not talking to those people. It's not
Catholic abortion provider,
right.
So,
And it's not my responsibility to change all these Trump voters. It is my responsibility to have difficult conversations with people who don't think like me, but also who actually want the same thing, a fundamental freedom to live a life of opportunity. So don't go talk to the crazies, but talk to the people who can have a real conversation with you. And then to their points, of course, call your elected officials. Over 100,000 calls were made on behalf of Planned Parenthood supporters alone because of this horrible, dangerous dump care bill, right? Like, so really call your elected officials and then shore up, we're all in New York, shore up your Democratic or your pro-choice elected officials and let them know, yes, I stand with you. And to your point, it's a marathon, not a sprint. We haven't even gone 100 days in this administration. I'm sorry, that's the reality.
I think, what is it, 66
66 days. We're getting ready for midterms, and I have a feeling that these folks in Congress, they know they've got like a little window of time to actually do something crazy before they have to actually let it go so that they can win re-election in 2018. So keep that pressure going because we had a huge win last week, and it can only get, but just don't get tired. Please don't get tired. We're not getting tired. Please don't get tired. And just bring more people to the fight.
Sybil, advice for people who want to get involved.
You're talking about a hard act to follow. At any rate, the reason that I played, you do need lawyers, believe it or not. You need very good doctors, progressive Latino women,
Sybil, can you speak into the mic?
From Planned Parenthood and so on. But you also need lawyers. It is the women in Florida who organized and got the law passed on the basis of the Florida Constitution and privacy laws in Florida, so that if Roe does fall, that Florida will have the right to an abortion. And there are several states where that has happened. And I urge you to look out for those states and to be active in those states if you know people who live there. I mean, I have a list of the states where the same thing has happened. Mississippi, Missouri, Kansas. So it's not only...
I think New York still has
New York, of course.
We still have the old Roe criminal ban on the books, right? Pre-Roe.
Yeah, no, that's fine. New York is fine. But who would think about Mississippi, actually? Who would really think about Mississippi? And I think that women in the United States, all over, have to know what is happening in all of the states. And I'll be happy to share that information with anybody who wants it. But I want to tell you about the scariest things that are coming forward in 2017. Father's permission bill. One of the most frightening pieces of legislation is in Oklahoma. The legislature has proposed a bill that would require pregnant women who are seeking an abortion to get consent from the sexual partner who impregnated them. Or pregnant women seeking, in writing, by the way. So
get ready. Well, so I really feel like we're just beginning. But I know that folks here have questions, and I want to give them a chance to come in.
Tell them one more thing that's important.
Okay, one more, and then we're going to questions.
Fetal burial rules. Over the past 2 years, 5 states, Arkansas, Louisiana, North Carolina, and Texas, have enacted legislation that requires burial or cremation for fetuses. And really, it's part of a wave of such laws that follow the undercover videos of Planned Parenthood.
Right, and we are also seeing that challenged in Texas. We're going to take our first question. Who's ready? Want to raise your hand?
Here. Oh, okay. So to your point about talking to the crazies,
let's get right in it.
Is Planned Parenthood conducting any outreach to the women Trump supporters who might be in need of Planned Parenthood services?
Oh. We did find, we did some research. We wanted to know what happened. We did some research and polling and that's how we found that majority of Trump voters did not want to lose access to Planned Parenthood. And some of those voters are our patients. And we say, and it is so true, we see anyone and everyone. And some of our health centers, they have stories of patients who were Trump voters and are talking to them like, well, I didn't think he was going to do that. I mean, when somebody tells you who they are, shows you who they are, believe them. But, I try not to understand that logic. But, so I don't want to say it's necessarily direct outreach. It is continuing to provide that non-judgmental quality healthcare to any and everyone. Even before this election, I have health center staff that tell us, they have protesters who are one day picketing outside of a Planned Parenthood health center. 2 days later, they're coming in to get healthcare.
And have you seen that in your practice?
Yes. Yeah. Not protesters, but people who will say, oh, I really thought I was opposed to this. I thought it was wrong. It's against my religion, but here I am. And then, we have to just, it's not a time for a lecture from your doctor. You need your health care and you need it then. And, from someone who's going to treat you with respect. But, those situations do occur and we don't have a litmus test. We don't ask people what they think before we give them an appointment. We'll give anybody an appointment who needs an appointment. But they're tough moments because I think they do reflect that kind of black and white thinking that people have that's very categorical about things and that isn't real. Real life isn't like that. And sometimes we have to move, when things happen to us, just like everything else, right? Questioning all the other beliefs we have that get challenged by experience. You have to, either you grow and you move along and you learn or you don't, so.
Yeah, and I think, we are in the business of providing healthcare, and we will always do that and always be the good man doing that. But we are urging these folks to tell their stories, right? Which is, I know probably everyone in this room rolls their eyes when they see another Trump voter say, oh, I didn't know he was going to do this. Like, I just watched the story of the woman who's losing her Meals on Wheels, and she voted for Trump.
The woman whose husband got deported and she voted for Trump.
I cried. Yeah. Like her husband got deported. Like what kind of conversation is that with your children? So it is encouraging these people to tell their stories, and maybe he'll listen. But at the end of the day,
the representatives. I mean, is that something that you guys must be making that case?
Absolutely.
Now.
I mean, we had at the beginning of March, we had 150 patients from all over the country go to DC with some providers and meet with their members of Congress. Paul Ryan sent his staff. But his constituents, who actually he is in an area in Wisconsin that has the most to lose if you block access to Planned Parenthood as well as Medicaid funding. His staff was apparently in tears and shaken. This is what we heard. So we are really trying to get these people to tell those stories to her point, the people who are up for re-election in less than 2 years.
Yeah, and it's amazing to see that in the Senate you still have 2-ish Republican defenders of Planned Parenthood. I mean, I remember when Lisa Murkowski voted to defund Planned Parenthood and then said that she regretted it more than any other vote. So as much as this has become so politically polarized, it's interesting that when push comes to shove, people still realize that Planned Parenthood is very popular with their people.
And that's so many, members of Congress, even when the meeting in Pennsylvania was leaked and there were several members of Congress, they were like, I don't want to touch Planned Parenthood before midterms. I know this is what we signed up for as Republicans, but we don't want to touch it.
And don't fall for that Planned Parenthood gets some giant check, some big grant, that they just get free money to do abortions. What was on the chopping block, which was, has happened in other places, is that Planned Parenthood can't take Medicaid.
Right.
Okay, and if you think that there's some parallel system that across the street from every Planned Parenthood, there's a wonderful high-quality clinic that will accept Medicaid and provide the services, I don't know what you're smoking, but it is not happening. So Planned Parenthood doesn't just take your Medicaid, their standards are incredibly high. So they provide really high quality care at a very low price for the people who need it because it's their mission. And we don't have, Paul Ryan is wrong. We do not have a bunch of federally qualified health centers just sitting around waiting to open their doors to all the people going to Planned Parenthood to give them the services that they need. It is not going to happen.
And I think when we saw when Pence was governor of Indiana and they cut funding for women's health, we saw an HIV outbreak. Right? That's the real implications of the kind of policies that we're hearing about.
He was the first governor to do that. And also, it's important to know that there are many states that don't accept Medicaid. And they've turned it down. And that's just unjust for the women who are seeking treatment for abortions and other things.
They've declined to expand it. So I want to just hear from the audience, maybe one more question. We have one over here.
Hi. So in regards to what we can do locally, I just want to plug that we currently have the Reproductive Health Act pending in New York. That's going to take abortion and from the penal code, where it's still under the heading of murder, and bring it into the health code, which is well overdue. 1970 was when that happened. And also would expand access to abortion by allowing, finally legally, midwives and nurse practitioners and physician's assistants to provide aspiration abortion, which California has already done. So I guess for Dr. Davis, my question would be, does Physicians for Reproductive Health take a stance on supporting the expansion of care by allowing these mid-level providers to offer abortion? And for Planned Parenthood, I know there's midwives across the country who are providing abortions, but oftentimes not aspiration abortions, only medication abortions because of these laws. So what can we do to get more involved in expanding care that way?
We absolutely support advanced practice clinicians providing abortion services, suction aspiration, manual vacuum aspiration in the office, and medication abortion, which is happening in some capacity in some places. California has really been a leader on that. And then it's up to us to train people who want to learn. And I know we have a lot of interest from the midwifery community to learn and become providers. So the more providers we can get, the better. And really trying to, I'm waiting for when this administration's going to start taking aim at abortion. That's coming up. Oh, hi. Colette, I didn't see you there. We'll certainly, there's going to be more restriction of abortion in the United States, not less, if anybody thinks it's going to go the other way. And so we'll be facing a situation where we have to find ways to get women medications to do abortion outside perhaps the traditional ways that we expect. So that's coming. So there's lots of things we have to think about, but getting more people trained and providing is a priority.
And
One of the states provides telemedicine. Telemedicine, where you take the 2 pills,
Right.
and you can do that at home. So I think it's Iowa. I'm not absolutely sure.
Jessica, did you want to?
Abortion happens at home now, even through
Yeah, right.
traditional pathways. So medication abortion's been around for a decade,
Some
and that's
states have
helped.
tried to ban it, but
Yeah, telemedicine's also been blocked in some places. So you get a workaround, you get a block. You get a workaround, you get a block.
Jessica, I know you wanted to jump in.
Here's something you all can do. Thank you for raising that. So you all can look up who your state assembly member is and your state senator, and please write them an email, call their office, tweet at them, and tell them to support the Reproductive Health Act, because in New York State, abortion still exists in the penal code. So it is important to change the law, and this is also, we have to target our governor as well. Because our governor needs to stand strong on this issue. At one point, we almost got it passed. There was sort of a 10-point plan on women's health issues, and the plan went down because of abortion. Under what? Under the bus. And one thing to something that was being said earlier about the protesters, I was visiting Whole Women's Health in the Rio Grande Valley in Texas, which was at the center of the recent Supreme Court case. And they had that situation too, that every morning all the protesters line up, and they talked about having one of those protesters come in and provide abortion care, and the staff provided compassionate care, as always. But that protester went back out and joined the picket line again. So, in some ways, we all love someone who's had an abortion. I like to quote my friend Renee Bracy Sherman. We all love someone who's had an abortion. And we do have to honor that people are in very unique places. But for those that can stand up and be bold and speak out and do all the things we've all suggested here, please do, because we need your voices. We need your voices. 1 in 3 women in this country will have an abortion in her lifetime. We need your voice.
Thank you. I can't think of a better note to end on. Thank you so much.